I'm Jeffrey Pfeffer. I teach at the Graduate School of Business at Stanford University, and I wrote the book Dying for a Paycheck, which won the RRBM award this year as one of the books recognized by the RRBM Association. I wrote this book because it was clear to me that workplaces were having a profound effect on human health and well-being. I wanted to explore the extent to which those effects were substantial, real, economically significant, and significant for health. And I found that actually the workplace is a much bigger contributor to ill health and to rising and indeed soaring healthcare costs than I thought. This book, I think, illustrates a number of the principles of the RRBM society and the movement. It illustrates the first principle of multidisciplinary. In doing this book, not only did I do interviews and with some colleagues, some statistical analyses, but the book draws upon literatures from medicine and epidemiology, as well as from the more traditional social sciences, such as sociology and social psychology. The book obviously has, or at least I hope it's obvious, has implications for both theory and for practice. The implications for practice have to do with how we treat people at work and the conditions at work and their effect on their health. And I think for theory, a point I made in an article which I wrote now 7 or 8 years ago, is that we as organizational scholars, as social scientists, need to consider the effects not only on profitability and productivity, but human well-being, human health, human sustainability, if you will, ought to be a dependent variable that we take seriously in all of our research. I was excited to learn that I had won this recognition and Dying for a Paycheck had won this recognition because, first of all, some of the founding members of the RRBM movement, Ann Sui and Jerry Davis, are colleagues and friends who I've known for a long time. I really am a huge supporter. I'm an early signer on to this movement. I think we do need to have responsible research in business and management that addresses real social issues and combines rigor with practical implications. So I was really excited to be given this recognition, and I'm particularly excited to be given this recognition at this stage in my career. Many of my colleagues, I think, believe I'm like too old to do anything useful. So it's nice to know that I'm still able to do things that have impact and wins both scholarly and practical recognition. So I was really thrilled to be given this prize. I think there are a number of implications of this work, which I hope will continue to stimulate other research by myself and other people. One implication is that if we are going to solve the soaring healthcare cost crisis, we need to do something about the workplace, because the workplace is where a lot of health effects occur. I think there are also interesting implications for how to measure and I hope there will be future research on how to measure the effect of workplaces on human health and well-being, even more than we've done, how to trace which are the companies that are doing the best and the worst with respect to managing their workforce towards human sustainability. And I really hope that this book and future research takes the idea, the topic of human sustainability seriously. Just as we have concerned ourselves with being green and environmental sustainability, which certainly is important, we need to worry about the human elements of sustainability as well. We need to worry about whether or not we are building workplaces in which people can thrive and at least survive, but even better than that, thrive both psychologically and physically. And so I hope this book and the research that it summarizes stimulates further efforts to understand what makes healthy workplaces and how we can create more of them. Thank you very much. It's been a pleasure.